Good afternoon. It's a rainy Monday here in Oneida Nation in Wisconsin, May 18th. And today we've got a little bit broader group of guests here for our segment. We are not able to socially distance, so we are going to keep our masks on today. And of course, we've always, we've sanitized our surfaces and make sure that it's been all wiped down and disinfected. I'd like to extend our sincere condolences to the family of Ken Hill, who passed away this weekend. One of our tribal elders, his daughter tells us he had pneumonia. He was 95 years old, and he was a great golfer, a great warrior and veteran, and he's certainly going to be missed. And we do want to extend our condolences to the family and to his friends. Michelle Myers is here today, and she's going to provide us with some of the statistics and the update on the medical update. Before she does that, I just want to say we did get a lot of questions over the weekend on extending the Safer at Home declaration to June 11th, that it is still in effect. It was extended previously, and it remains in effect. There were a lot of questions from our community because of the actions of the Supreme Court and also Brown and Outagamie County, which thought that they could continue the Safer at Home. However, they were prompted to lift it by the recommendation of the attorneys in both the counties. Our stay-at-home order has provisions for the government and the public health officials to recognize the development and adoption of safe plans to reopen. That's the case with, again, the case with Thornberry as well as the case with the casino. They have both followed the process for developing safe plans for reopening, where they have implemented many new measures. So we did want to talk a little bit about that. The tribe is constantly reviewing our data and our metrics in order to make these decisions. And the business committee and the public health teams will continue to review that information and watch what's happening in our community, so that when we do get to a point of opening up the reservation, that we can do it in a safe and deliberate manner. So with that, I'd like to have Michelle Myers, our public health officer, please give us our latest update.
Thank you, Bobby. So I'm going to start with some statistics. Globally, there are 4.7 million COVID cases, over 317,000 deaths. In the United States, there are 1,486,000 cases, over 89,000 deaths. In Wisconsin, we have 21,453 cases of COVID with 453 deaths. In Brown County, we have 2,096 cases with 22 deaths. In Outagamie County, we have 139 cases of COVID with 4 deaths. Then for the Oneida Nation jurisdiction, we have a total of 23 cases. We have 12 in Brown County, of which 4 are still in isolation, and 14 in Outagamie County, of which 10 are still in isolation. For Indian Health Services, there are 7,053 cases of COVID. For just the Bemidji area, we have 100 cases. For the Navajo Nation, 4,172 cases. Albuquerque, 594 cases. And the Phoenix area, 881 cases. So using science and evidence-based practice, public health officials have worked tirelessly to protect communities from COVID-19 pandemic. We continue to support prevention measures and encourage the community to do their part to slow the spread of COVID-19. I wanted to provide some clarity on decisions and activities that occurred last week regarding Safer at Home orders in Wisconsin. On Wednesday, May 13th, the Wisconsin Supreme Court ruled on the challenge to the Safer at Home order. The decision was to overturn the Wisconsin order was based on a technicality in the process used to enact it. It was not about the merits of how Safer at Home order protects Wisconsin residents. Because of the chaos this decision caused, many local public health departments, including Brown County, the City of De Pere, and Outagamie County, quickly enacted local public health orders to continue the same safety measures as outlined in the Wisconsin Safer at Home order until a plan for safe reopening could be implemented. Unfortunately, the local public health orders were rescinded later in the week. This essentially led to an uncontrolled reopening in Wisconsin. Although some community-minded businesses have been implementing prevention measures to protect employees and customers, there is no longer a mechanism in place to require it in most communities. More than ever, the community will need to be vigilant in maintaining the prevention measures as discussed these past several months. Wash your hands frequently. Cover your mouth when you cough or sneeze. Stay home when you're sick. Limit non-essential travel. Engage in social distancing. And wear a cloth facial mask when out in public. An important note, the Oneida Nation issued a Safer at Home order on March 26, 2020. Which at present extends through June 11, 2020. So regardless of what has occurred at the state and local levels, Oneida's Safer at Home order applies to tribal members and businesses within the Oneida Nation reservation boundaries. Ongoing evaluation of local data has and will continue. Should any changes to the Oneida Nation Safer at Home order occur, notification will go out to the community. Be safe out there.
Thank you, Michelle. And now we're going to be addressing the financial issues here with our representatives of the COVID finance team. We have Treasurer Trish King, our CFO Larry Barton, our Chief Counsel Joanne House, and our General Manager Debbie Thundercloud. Please keep your questions germane to the panel here so that we're, here's one like that office. Excuse me. So stay in line with the questions so that we can answer them accurately. And without any further ado, Treasurer Trish King, we're ready for your address.
Thank you, Bobby. Sagoli Swapwake, Trish King, Tribal Treasurer. I'd like to thank you all for participating in today's Facebook Live. And to acknowledge other members in our team besides who are here today. We have Assistant CFO for Lyndon Ninham Lambries, Assistant CFO Gaming for Chad Foos, and HR Manager Geraldine Danforth. It's important to understand that the Business Committee is required to maintain confidentiality of our nation's finances. Therefore, this Facebook Live update will not contain detailed budget information, but rather a general overview of the financial situation. Our financial path leads us to the nation's vision. A vision communicates what our nation believes are the ideal conditions for our community. How things would look if all the issues important to you were actually perfectly addressed. A vision is a nation of strong families built on Jikiyum Gwalihoda and a strong economy. That is the Oneida Nation's vision. One of the many tools we utilize on our path towards our vision is a budget. Adoption of an annual budget is an important component of the nation's fiscal planning for sustainability. On September 16, 2019, GTC adopted the fiscal year 2020 annual budget. The Business Committee reported all projected revenues from tribal enterprises, programs, unit earned income, grants, tribal allocations like self-funded premiums, indirect cost pool income, depreciation, and other sources like prior year carryover, hotel room tax, and general fund interest. Over 50% of the projected revenues derive from gaming enterprises. These projected revenues are based upon gaming being open 364 days a year, or at least usually one day off for Christmas. Unfortunately, this pandemic has caused gaming not to be open for 364 days. As of today, the casino will be closed for 58 days. This means gaming revenues have decreased 100%. The last deposit from our gaming enterprise was made on March 25, 2020. The projected expenditures during fiscal year 2020 included the divisional operations, tribal enterprises, GTC mandates, contingency budget, endowments, CIP, equipment, building and maintenance, technology, economic development, 7 Gens dissolution, and land acquisition. These operational expenditures were projected to cost approximately $2.5 million per week, and then we add to that payroll expenditures, which was another projected $2.5 per week. With all that said, the fiscal year 2020 budget has become a dream that will not be realized. This pandemic has caused our nation to come to a place where we have to adjust in all aspects, including our budgetary and fiscal plans. Rest assured, our team, our business committee, we are closely managing our cash for essential critical purchases and operations. And since the pandemic will impact the economy well into the next 3 to 5 years at minimum, we will continue to only provide essential critical governmental services through fiscal year 2020 and fiscal year 2021. Again, we expect our recovery to be extremely slow. As we begin planning for fiscal year 2022 and beyond, there remains an unknown variable. When will gaming open its doors? And once that occurs, how will our valuable gaming customers return? As previously stated, we anticipate the return of business to be very slow, and I extend emphasis on very slow. The economic impact and crawling our way out of the effects of the COVID-19 pandemic is at very minimum, 3 to 5 years. Based upon the drastic decrease in projected revenues, the truth to our nation is, very simply, we can no longer be dependent on gaming revenues to develop a budget based solely on projected revenues. To be clear, we must develop policy where the budget will derive from real cash in the bank and not projected cash based on trending and forecasting. We must prepare our financial plan with supporting strategies to be based upon fact, mindful information, and data so that our financial decisions are based upon what we have available. Future expectations for our businesses are that they will meet their sales projections and redefine their business models to reduce overhead. Expenditures for our programs will be outcome-based, measured, and have value to our community members. Our 3-year financial planning, along with updated fiscal and budgetary policies, will reflect these expectations so that we continue towards sustainability. The word Jitniungwalihoda cannot be easily translated to the English language. Yet this word describes that we have everything here to sustain us. We will strive to continue providing health care, housing, food, and critical infrastructure needs while carefully managing and rebuilding our resources now and into the future. The COVID-19 pandemic is challenging all of us. It is more important now than ever that we continue working together towards sustainability for our families and for our nation. Yonko to each of you for your understanding, your support, your help to one another, and most importantly, Yonko to the frontline heroes and warriors of our nation. Your continued work is greatly appreciated. Together, we will survive and we will reach our sustainability goals. You'll vote.
Thank you, Trish. I have a question. Previously, the finance team was to be on Facebook Live, and at the time, actually the day that it occurred, the tribe received some stimulus grants or monies. The question is, how much stimulus has been received from the federal government?
Do you have it? I'll turn that to Larry to give an overview of those funds.
Thank you, Trish. With specificity, the healthcare process and function has received one-time enhancements of federal funding of approximately $11 million. The $8.8 billion carve-out specifically for federally recognized tribes was $8.8 billion in total. Our portion of that was $39.6 million approximately. So we are in receipt of those dollars. We have to comply specifically with the provisions of the program carefully. So we've set up process for which to disperse those funds, onto which many of the COVID-related direct expenses will be reimbursed back to the tribe. It's important to note that it is not treated as a cash source for which operations can derive funding. It's got to be specifically within the carve-out and language in the bill, in the federal legislation. So in total, slightly over $50 million in the aggregate. It sounds like a lot of money. However, given our financial challenges, we can't view it as a, if you will, resource to, if you will, navigate us out of our financial challenges.
Anybody else care to add anything to that? All right, another question is, what kind of plans do we have for bringing our tribe into a better financial position in the future?
Go ahead, Larry.
I think fundamentally some thoughtfulness about capacity of labor, onto which at least the finance function has articulated limitation, gave pause and direct caution and disclosure to our membership. I would ask folks look at not only our prior PowerPoints with that, I'll call it, frontal warning. I think there has to be some core add back as to the determination of essential and non-essential functions. What can stay, what can go, based on what the treasurer articulated, in that gaming is going to come back relatively slow in comparability to the pre-March 18th shutdown. The Federal Reserve Board Chairman Jerome Powell was on 60 Minutes last night, and he's at a station to which he gets the formal economic data. He edified the fact that the economy is not going to come charging back. We may see some upward momentum third and fourth quarter, but it's going to be relatively slow. We know that unemployment levels will approach 25, if not 30%. So if a third, arguably, or lower of our workforce does not have access to gainful employment, that consumer spending will show up not only in gaming, but a variety of other, if you will, industry sectors. So importantly, the velocity on the movement of spending from the consumer standpoint is going to be very, very slow. So making a point, our thought about how our labor construct really needs to be carefully evaluated. I don't have a specific answer as to service delivery, but really a core determination of what is essential and non-essential. We have to have a frontal discussion. We have had many programs, some of which were grant driven, which were value added, but frankly, if we can live without those service delivery functions by a matter of necessity, we're at that point by virtue of the amount of resources that we do have. I don't have a judgment onto the general membership mandates, but that's also a discussion and an exchange we'll have in future general tribal council meetings. We have been what I think is reasonable and benevolent, given the resources we have. But I think there's going to be a fundamental discussion on really what's most important to the community. And again, we highlight the fact that this should come as no shocker in the sense that Rolinda, who was in attendance, did give pause at our January General Tribal Council meeting that if gaming ever went down, we would have a three-week burn rate on our liquidity. So we want to make everyone aware of that. The transcript will reflect that. Now, truth of the matter, Finance did disclose public, if you will, health crises as a potential risk, however remote the probability, but it did happen. If I would have bet lunch on it a year ago, I said, well, the odds of that are pretty remote. When I did bring it up, this is June 4th of 2019 with my PowerPoint, my risk wheel did have public health crises leading to profound social disruption. And if anybody wants the slide, I can send it to you. Dr. Veer did validate that the CDC was giving warnings, Bill Gates was giving frontal warnings. Again, if I would have bet lunch on it, I would have said, well, maybe not in my lifetime, but it did happen. So remote as some of our risks are, these things do happen in life. We've done the best job we can in terms of reacting from a public health standpoint and many other aspects. I think the community will learn from this crisis on so many fundamental levels. The importance of effective resource allocation in the larger sense that we get back to really looking at what is most important to us as the Oneida community. Thank you.
Thank you, Larry.
Joanne has a comment.
Joanne?
Our CFO has pointed out some incredibly dire consequences that have come to light and actually supported. Our labor levels are too high. Our services exceed the funds we have available. For the next fiscal year, we are looking at putting together a budget that is within our means, and that generally is going to be a very restricted budget, restricted to the grant funds that are available, and all of the extra contributions we were able to make in the past. We can't do that anymore. So we are looking at overhauling the entire budgeting process so that we begin working on a budget based on the revenues from the prior fiscal year. This will take us several years to get into place, so that we have a budget that's solid and won't fluctuate based on the economy. It'll be based on the money we already have. It's not an easy transition to make, and we're doing everything we can to try to put as much guidance in place to get us to that position. Thank you.
You're welcome. In one of the statements that are here, it's not so much a question as a statement that says, in one of the upcoming publications that we receive, they would like to see what remains open in terms of our departments, our operations, what that budget is, how many staff, and how many fit into the nation's definition of critical. And I know that that's a question. Is this forced the tribe into a very devastating situation where decisions had to be made immediately, positions were cut, services were eliminated, and obviously gaming took a toll on us tremendously when we shut the doors. So because of the quick turnaround of the issues, I don't think we've had the time to put together a very well laid out picture of the impact and what our structure looks like now and those budgets. So I think it's well advised to put that together. All right, I'm gonna. Are we really need to? I'm not sure I understand some of these, some of the questions. If we're expecting there to be a slow reopening, why are we not opening up one building at a time? I'm not sure if that refers to gaming, that they're opening. I'm just going to assume that they're not to our operations.
Right.
And as we said, we'd like you to address those issues, but I think maybe Larry can answer that.
I'll defer to Chad if he's on the call, but I'll just add that it was a decided public health, I'll call it, measure, so as to not overcrowd and stack clients and customers up at one location. That way dispersing with one opening for all the facilities to disperse and space our customers for safety purposes. It's also important that leadership from the clinic carefully reviewed gaming's reopening plan for the purpose of safety, not only for our employees, but most certainly our valued customers. Thank you.
Okay, thank you. There's a question that was back, and I just want to address that. There was a concern that our elder who passed away, that it was due to COVID. That is not true. Speaking to a family member, personally, I spoke to the individual and she said he had pneumonia. So it was not COVID related, just to clear that. However, due to the COVID situation, they are not able to have an extensive ceremony, that it would be just for immediate family members only. So I hope that clarifies the question about our elder. There was a question, and I can't find it right now, about whether or not, I hope I represent this right, whether or not the health center will be able to cover prescriptions. Is there anybody who can answer? Larry?
It would appear that we would not have any significant disruption, as that is an essential service, and we will continue on as such providing medications in accordance with our compact with IHS. We don't see any disruption there. As previously noted, we did receive one-time funding enhancements of approximately $11 million. I don't anticipate, at least from a financial or service delivery standpoint, that in any way access to medications would be diminished. So I will defer to clinic leadership with specificity, but we don't see that from a financial standpoint. And if that were the case, we certainly would find a way.
Okay, thank you. Another question. There have been discussions over the years of consolidating like services. Can anyone describe if and or how this will be an ongoing strategy for sustainability and integration of talent? Is that maybe, Debbie, is there something, can you address that, please?
We plan on doing analysis and assessments of all our programs and services to see if there is overlap and if there can be collaboration between existing programs. There's a program out there called Lean, where you look at your processes and try and eliminate unnecessary steps so that you can become more effective and efficient. So we'll be looking at some of those things from an operational perspective as well. So yes, we will be trying to consolidate wherever we can.
All right, thank you, Debbie. There's also, I guess it's a question as to, I'm sorry, it's kind of hard to find the questions once they go by, but it was something about putting slot machines inside the back of the one-stops as we had previously done. And I don't know if anybody here could answer that. I know it does have something to do with the infrastructure and the cost, etc. Joanne?
There are two reasons why the slot areas or the gaming areas in our one-stops are not being reopened. One, they can't properly social distance in those small areas, so they couldn't open them safely to the public. In the one-stops that do not have gaming operations, the infrastructure for slot machines the surveillance and all of the other activities, regulatory activities that take place in those areas, would be a significant cost to put all that in place. Gaming has gone through the revenue and expenses for every one stop where there has been slots or gaming activities, and has determined that the cost exceeds the expense or the revenue in those areas, and that's why they were taken out in the first place. Putting them back into those facilities wouldn't resolve an issue of revenue growth.
Thank you, Joanne. What are some of the examples in the carve out? What can the 50 million be applied to? Joanne?
Right now, the COVID relief funds have to be spent on COVID-19 directly related activities. And there are about 4 questions that you go through to decide whether or not the funds can be utilized for any purpose. But we are looking at the application of those funds in the broadest manner that we can, in meeting both the organization and the community's needs. However, we are being also very careful about how those funds are spent to ensure that when we get audited in the future regarding the CRF funds, that we've spent them properly, and we have the appropriate document in place to show exactly what we spent those funds on.
Right. There's another statement that just mentions that they're a little disappointed that we have more of a narrative and not the actual budget. But as we mentioned at the beginning, that there would be no actual budget or statistics that we share. If there's that kind of information, it would be found in our members only page. So I just want to remind you of that. Okay. I'm sorry, I'm scrolling for these. There's a lot of comments that aren't necessarily related to us, a lot of questions about that should have been referred to HRD, unemployment questions. And now my sound went out. Okay. Okay, so a comment on Tricia's report implying that our budget will be based on accrued revenue. How can a budget be proficiently done without any type of speculation or financial forecasting?
There always has to be financial forecasting. However, what we're expressing is that the necessity is to have cash available for our programming, so that if we should ever hit this pandemic kind of a situation again, that we're not reliable on one source of cash coming in, that we do have the funds in the bank, and that our planning and projections, we still have to do that. We still have to plan, we still have to project, we still have to prepare for utilizing our funds in the most proper way appropriate. Things that meet our needs versus our wants. It's very critical that we downsize all of our expenditures to actually meet our needs. And that's where we get into the basics of the quality of life kinds of things. The food, the shelter, the public safety, the education, things like that is what we have to focus on now.
Okay, as a small business owner, is there any help for small businesses? Larry?
Bobby, yes. I would advocate to visit Mr. Jeff Bowman at Bay Bank. Visit the SBA website. Treasury did approve The payroll protection program, most if not all of those funds unfortunately have been allocated out, but it wouldn't be a bad idea to get the application ready in anticipation that a new tranche of funding is made available this summer. Of course, the House approved, I believe it's the 4th package, and the right side of the aisle and the Senate is going to take the bill up, but it appears it'll die in committee. If there's a compromise that goes to the White House before they adjourn for summer, it's reasonable to assume additional resources would be made available. So contact your local bank or Jeff Bowman over at Baybank.
Okay, thank you.
Joanne has a comment quickly.
Did you have more to say, Trish?
Joanne?
Oh, I'm sorry, Joanne?
I believe, contacting, it is, Wisconsin Economic Development Corporation. I believe there's a new set of small business programs available through the state. I just received the governor's announcement regarding that, so I'm not sure what the qualifications are. We have been requested to research the potential to do small business grants. We know that small businesses have suffered during this economic downturn, closure of all businesses. And we think that there may be some availability within the COVID relief funds that the nation received. So we are as quick as we can, researching that and researching what, if any, resources the nation can make available to small businesses. We hope to get that done soon.
All right, thank you very much. As usual, we get a lot of HRD related questions about hiring processes and such. So I do encourage you go to our COVID webpage and look at the HRD resources that are listed on that page. Our experts here aren't equipped right now to answer all those HRD related questions. Our next regular Facebook Live would be Friday, however, that's Oneida Nation Code Talkers Day. And so we will have our segment on Thursday, May 21st, at which time we'll welcome our guests from EAP, Carol Bauman and Crystal House. In the meantime, continue practicing all the things under our Safer at Home order. Keep your prayers, we need them. The families of those who are dealing with the COVID, appreciate those prayers, and we're seeing people come out of isolation, seeing people come out of ICU, and seeing people getting well. The Navajo Nation has been hit hard, as many of the other northern tribes in Washington State as well. We ask you to continue your prayers for them. And I just want you to remember that as Native Americans, we've been fighting viruses, plagues, pandemics, and biological welfare since 1492. And I want to thank someone special for this shirt today. And remember that we'll get through this if we stick together on this. Y'all won't go?